Hello mga KSFT, today is Wednesday, January 12, 2022 and here's the news you need to know. May severe outbreak na ng COVID-19 sa Metro Manila, ayon po yan sa grupong OCTA Reseach. Ayon sa grupo, halos 70 ang bagong naitatala nagpopositibo sa bawat 100,000 population kada araw. 48% naman ang positivity rate sa Metro Manila, ibig sabihin sa kada dalawang nagpapatest, isa ang nagpopositibo sa COVID-19. Sabi ng OCTA Research, bagamat tumataas ang mga kaso, mas bumabagal na raw ang pace nito. Ayon naman sa DOH, bagamat dumarami ang kaso sa Metro Manila, hindi raw masyadong dumarami ang severe cases dahil sa mataas na vaccination coverage. Hindi na kailangang itaas pa ang alert level status ng Metro Manila mula sa kasalukuyang Alert Level 3 ayon sa opisyal ng World Health Organization o WHO sa bansa. Ayon kay Dr. Rabindra Singh, County Representative ng WHO sa Pilipinas, sapat na ang restrictions na umiiral ngayon sa NCR. Sabi ng WHO, hindi pa naman daw kasi umaabot sa moderate risk level na 71% ang healthcare utilization rate sa rehiyon. Pero pinapaalalahanan nila ang lahat na sumunod sa mga ipinatutupad na health protocols. Hindi pa man isasapinala ang pagbibigay ng 4th dose, pinag-aaralan na rin daw ng vaccine expert panel ng gobyerno na gawing 5 doses ang bakuna. Yan ang sinabi ni Vaccine Czar Secretary Carito Galvez Jr. Ito'y para maabot daw ang full immunity laban sa COVID-19 pero wala pang pinala desisyon tungkol dito. I'm Joseph Morong. Stand with us. Stand for truth. Mga KSFT, walang bakuna, walang sakay. Yan ang ipatutupad sa lahat ng public transportation sa Metro Manila. Simula po yan sa Lunes, January 17, 2022 habang nasa Alert Level 3 ang NCR. Nakasaad yan sa Department Order 2022-001 ng Department of Transportation o DOTR. Kugnay pa rin daw ito ng utos ni Pangulong Rodrigo Duterte na i-restrict ang galaw o movement ng mga unvaccinated o hindi bakunadong individual. For the record mga ka-Stand for Truth, ano ang iba pang nakasaad sa inilabas na Department Order ng DOTR? Nakasaad sa order na hindi na pwedeng bumiyahe ang unvaccinated sa lahat ng domestic travel to, from at within NCR via public transportation by land, rail, sea at air. Kasama sa restrictions sa nag-iibang lugar pero nagtatrabaho sa Metro Manila. Para makasakay, kailangan magpakita ng vaccination card o vaccination certificate. Exempted naman sa no vaccination, no ride policy ang mga may medical condition na hindi pwedeng bakunahan ng COVID-19 vaccine. Kailangan lamang magpakita ng medical certificate. Exempted din sa policy ang mga bibili ng essential goods pero kailangan magpakita ng barangay pass.
Ang pagkakaalam po namin, ang vaccination rate ng NCR po is already at around mga 91% already. So ilan na lang po yung mga tao na hindi po nababakunahan. At tulad na nga po sabi ng ating Presidente at saka ng ating Secretary Tugade, kailangan pong encourage natin itong mga to na magpabakuna.
Sinabi rin kanina ng DILG na kinukuha na ang pangalan ng lahat ng unvaccinated sa mga barangay.
Para po masiguro natin yung datos natin ng mga unvaccinated, nagpalabas po si Secretary Anyo ng Memorandum Circular para magsagawa ng inventaryo ang lahat ng mga barangay sa buong bansa para malaman yung mga hindi pa nagpapabakuna sa mga barangay in line with the pronouncement of the President.
Kung kayong tatanungin mga ka-Stand for Truth, pabor ba kayo sa ipatutupad na no vaccination, no ride policy? Narito naman ang sagot ng ilan natin mga ka-Stand for Truth. Dapat namang itaas sa Alert Level 4 ang National Capital Region o NCR dahil sa patuloy na pagtaas ng COVID-19 cases. Ano nga ba ang mga posibleng epekto kapag hindi agarang nagpatupad ng 2 weeks lockdown ang gobyerno? Ang mga kasagutan sa panayam na ito ni Richard Hederian, kay Dr. Anthony Lechon, ang dating National Task Force Against COVID-19 Advisor.
Alright, mga kapuso, kasama po natin ngayon si Dr. Anthony Lechon. I'm sure he doesn't need any kind of introduction. Isa po siyang staple sa ating headlines and discussions throughout the pandemic. In many ways, I look at him as a public health expert, no? At malaki po yung kanyang contribution to an informed and I would even say a sane discussion of how to deal with the pandemic. Kamusta po kayo dyan, Dr. Lechon? Thank you very much for joining us.
Well, okay naman, Richard. Busy lang sa telemedicine. A lot of patients are consulting ngayon dahil hindi makapunta ng hospital and ang volume of patients dumami with Omicron.
Ano mga preliminary assessment nyo, Dr. Lechon, dito sa mukhang spike, no, in terms of cases, at least based on the official numbers we're seeing?
Because of the global inequity sa bakuna, with poorer and smaller countries na mababa ang vaccination rate, this will give time for the virus to mutate, kaya nagkakaroon ng variant. And slowly as the data and science were evolving, nalaman natin that this is rapidly transmissible, is 4 times more transmissible than the Delta. And when there's mobility and there's travel, nakaikot na sa Southeast Asia. So dumating sa atin, November 26 siya, dumating siya, ang first one natin ay first week ng December. Nung nandun ako ngayon sa Baguio, everyday nag-i-increase. Until umuwi kami December 30, nasa range ng 1,620 and slowly. So if you're gonna count from December 20, in just 2 weeks, it zoomed from 889 to a record-breaking high yesterday of 28,000, with a record high also in terms of positivity rate of 44%. And sa NCR 50%, meaning to say 1 in every 2 persons will turn out to be positive.
Yung sinasabi na milder ito, what does milder mean? Milder in what sense? In terms of symptoms, hospitalization rate? What are we looking at, Doc?
So pag sinabi mong milder in symptoms, right? But to me, this is a disease. Kung nyari mild siya pero rapidly transmissible, may caveat, may caveat. The sheer volume of patients in such a short time lang can overwhelm a whole community and the healthcare system. So eventually, yung moderate and severe, mapupuno yan eventually. Hindi lang hospital, but the whole community.
Doc, you have made a suggestion that perhaps we should move towards another circuit breaking, kind of a more lockdown approach, alert level 4 siguro.
Right.
Do you think this is really the only way forward? Kaya ba ng economy natin yan? Kaya ba ng taong bayan? Hindi ba napagod after 2 years of pandemic almost?
Ako, I hate lockdowns kasi as an ex-advisor of the NTF, ang worst kung ngayon ay mag-lockdown. But this one is an unforeseen incident na we have to roll with the punches not because naka-taste na tayo ng ganito ay hindi tayo pwede mag-adjust. Kung maintindihan lang ng taga-government, I'm sure maintindihan na hindi pa daw alert level 4 pa. Pero these are the considerations. The new cases dati na 28,000 and the positivity, mind you, is a record high. Kasi ang dati natin record high was last September 11 with the Delta variant. That's number 1. Number 2, underestimated yung figures na yan kasi hindi na i-input dyan ang rapid antigen test. Hindi pa kasama yan kasi RT-PCR lang. And then the backlog of the Christmas holiday season. And then the other laboratories na hindi nakakapag-submit. For example, Visayas and Mindanao because of the typhoon Odette thing. Diba?
Right. Yung
so all of these things kailangan mong i-put into consideration. Pangalawa, 61% of the total cases in the Philippines ay nasa NCR. So ngayon, we see right now, it's escalating in the Calabarzon and Central area, Central Luzon. So pag umakyat siya na Northern Luzon and Bicol area, it's easy to spread to the Visayas and Mindanao and might reach the evacuation centers of the Typhoon Odette afflicted areas. So we cannot fight multiple battles. What we're saying is a 2-week lang and use this particular circuit breaker to buy time para makabili ng test kits ang mga tao, may prepare yung kits ng mga tao kasi paracetamol and all And then prepare also for the boosters. Mas mahalaga yung boosters eh.
We're hearing a lot of people saying, oh, see, wala palang size eh. And lahat tayo, mga fully vaccinated. Nagkasakit yung tita ko, nagkasakit yung ganito ko. Paki-explain sa audience natin why vaccines still matter and why we should get actually another booster. No? What does vaccine provide for us regardless of mutations and variations and higher levels of vulnerability as we move forward?
Now, kung bakunado ka, let's say nakakompleto ka na, it doesn't mean na libre ka na. You can have breakthrough infection and defined as 2 weeks after your last dose. Kasi ganito po yan mga kababayan. Ang 1 dose, according to Professor Nina Gloriani, chair of the Vaccine Expert Panel, will give you 50%. And then 2 doses will give you 70% protection. And 3 doses, 90%. So ibig sabihin mga kababayan, since bago pa lang ito, it doesn't mean that the vaccine does not work. It's just that the virus is so I would say ferocious,
Right.
Relentless,
And
so
evasive.
evasive.
Yeah.
In order to defeat Omicron, hindi siya 2 doses which actually defeated yung Delta.
Yeah.
It will need a 3rd dose. So very important for the government to concentrate on the 3rd dose right away kasi immediately yan ang may impact. So they have to look on their files kung sino yung naka-2 doses na, yun ang bigyan nila kaagad ng booster. So that you can actually create herd immunity na so that the Omicron cases will go down. Yun ang aking tingin dito.
Kamusta naman sa Pilipinas over the past 2 years? Are we moving in the right direction? At saan pa tayong kapos na kailangan mag-improve in 2022?
Ang weakest link natin ay testing and tracing. Hindi natin na perfect yung testing, hindi natin na perfect yung tracing. Hindi rin tayo nag-benchmark with the rest of the world while Taiwan, Singapore, Canada, Europe, and US, nag-DIY na sila self-administered kit, hindi tayo nagbago. So, nung nagkaroon ng Omicron na kailangan ng rapid antigen test, wala, para tayong naiwan sa pansitan. It came at a time na kailangan mo tapos na out of stock ka pa.
So ano ba yung worst case scenario na tinitingnan nyo dito, Doc? What is the nightmare scenario should we not go with the circuit breaker?
Sana hindi mag-mutate siya. Kasi may mga findings ka na Florona sa Israel nag-combine ng influenza at Omicron. Tapos nag-hybrid. Tapos merong report na Delmicron nag-combine ang Delta at saka ang Omicron, ang tawag na Delmicron. Pag nagkaroon sila ng recombinant at saka magiging super mutant siya. Lalo na kung mababa ang vaccination rate mo. Sana wag naman. Omicron has just started at wala pa tayong 2 buwan dito para malaman ito. So, kung ako, worst case scenario thinker muna ako, I have to nip it in the bud. Kung tumataas siya, kailangan tubigil ang transmission niya. Right. And then, after that, 2 weeks lang naman ang hinihingi mo. Kung napababa natin yan, kasi as long as there's mobility, the virus will keep on moving and moving. So, the right approach, based on the hammer dance concept ni Professor Thomas Pueyo, is lockdown ka muna ng 2 weeks and then reassess.
Thank you po and take care po. Thank you very much for joining us, sir.
Thank you very much.
And that's all for today, mga KSFT. Don't forget to like and follow Stand for Truth GMA Facebook page for the latest updates. I'm Joseph Morong. Stand with us. Stand for Truth.